Welcome, everyone. Thank you for joining us again for another webinar from the National Association of EMS Educators. If you're a returning listener, welcome back. And if you're brand new to the NAEMSE webinar series, we are very glad that you joined us today. NAEMSE is proud to announce that today's webinar is in collaboration with the National Registry of EMTs. Before we get started, I want to fill you all in on some of the controls available to you today. Attendees are in mute-only mode during today's webinar, but please interact with us if you have any questions or comments by submitting those in the Q&A panel on your Zoom screen. Today's webinar is being recorded and will be available on our YouTube channel and our website following the conclusion of the presentation. NAEMSE is offering 1 hour of CAPC-approved CEU for those who attend today's live webinar. To receive their certificate, I'll send a link in the chat at the end of the presentation, and it will be included in tomorrow's follow-up email. If you follow that link, you'll be able to register for your CEU certificate on the NAEMSE website. NAEMSE members receive their certificate free of charge, and it's $25 for non-members. Today's webinar topic is Foundations of Item Development, presented by John Corley Jr., Stakeholder Program Manager of the National Registry of EMTs. I'm going to pass it over now to the National Registry. Thank you so much for joining us today, and we are looking forward to this presentation.
Thanks, Rio. Hi, everyone. My name is Emily Kirchner. I am the event coordinator with the National Registry of EMTs, and I wanted to welcome you all to this webinar and thank you for taking the time out of your busy schedules to be here with us today. I also wanted to thank the National Association of EMS Educators for partnering with us and providing us this platform on which to educate the EMS community. Moving on to a bit of housekeeping before we get into things, today's webinar will run for a maximum of 90 minutes, and we welcome questions, so please submit your questions during the webinar via the chat, the Q&A function, not the chat function, please. And we appreciate your partnership. Moving on to the agenda, we will have a brief introduction to the National Registry, followed by a deep dive into foundations of test development, and we will have a Q&A session at the end of every section. So again, please submit your questions throughout. And with that, I will turn things over to John Corley.
Thank you, Emily. My name is John Corley. I work for the National Registry. I have been with the National Registry for about 5 years. I'm on the stakeholder partnerships team now, but I used to work on the examinations team. If you've been to an item development panel within the last 4 years or so, you've probably seen me. I've also been at several conferences. Just some things to talk about in the very beginning here with the National Registry and what do? Do we define the National EMS scope of practice? Do we develop ed standards? Do we develop national EMS model protocols? Do we approve paramedic education programs? The answer to all of those things is no. NHTSA defines the EMS scope of practice. Education standards, NHTSA again with NAEMSE. NAEMSE develops the national EMS model protocols, and COE approves paramedic education programs with states. Do we approve Con Ed? No. That's CAPC in the states. What about authorization to practice as an EMT or a paramedic? Again, states establish the rules for interstate practice. That's the compact. Credential providers. That's the EMS agency. Administer national EMS certifications. That's the National Registry. So our mission is to provide a valid, uniform process to assess the knowledge and skills required for competent practice by EMS professionals throughout their careers, and to maintain a registry of certification status. We were formed in 1970. We're a nonprofit organization. We have a national certification board that oversees our operations. We are focused on public protection. We are focused on knowledge and skill assessment for EMS personnel, and we maintain the nation's EMS certification database. We're an accredited organization, accredited by NCCA.
At this time, there's no questions, John.
Thank you so much. So at that point, we're going to get into the foundations of test development. So the foundations of test development, what we're going to talk about at first. And when we start talking about test development, we're thinking about legal defensibility, reliability, validity, those types of things. To start, we need to define what an assessment tool is. An assessment tool is designed to measure test takers' knowledge, skills, and abilities. Examinations must be valid and legally defensible. The National Registry's examinations development lifecycle establishes these concepts. It starts with the practice analysis. The practice analysis is a snapshot of current EMS care. And it is a picture of what we do in the field as EMS providers. So the practice analysis looks at what exactly do providers do out in the field, what care they're providing, and what tasks are they doing. From that, we create the test specifications. We're going to write and create the test content from that, pilot the new test questions, perform a statistical analysis on those things, perform standard setting, and have an ongoing evaluation. So a deeper dive into these things. The practice analysis, as I said, captures current EMS care. It establishes content validity. Our last one involved 3,500 EMS professionals with data from about 10,000 EMS agencies and nearly 30 million EMS runs. This is what gives our examination its content validity. Because what it's going to do is it's going to say, okay, what is it that paramedics and EMTs are doing in the field, and how can we take a look at that and get that into the exam? It's a practice analysis. After the practice analysis is done, we're going to create something called the test specifications. And it's an analysis of the analysis. It's based on the practice analysis, and it starts with the test blueprint. And the test blueprint is an analysis of that practice analysis that determines just exactly how much content from which domains should go into the examination. It provides content domains and links EMS practice to exam content, and is a solid component of examination validity. After that, we write and review test questions. The test specifications and blueprints, again, linking back to the practice analysis, which links back to EMS care, write and review those test questions and items from that blueprint. This is what's going to determine how many test questions from what content or domain areas go on to the test. This is done by external people, external folk. We bring in volunteers to come in and take a look at these things and write the test questions and review them. And they go through internal and external reviews. The first thing we're going to review for after we get them from the item writers is for clinical accuracy. The item writers are going to do that. They're going to reference the test questions to referenceable material. Internal and external reviewers are going to do that. We're also going to do internal quality checks. We're going to look for style and grammar. We're going to make sure that it's up to snuff when it comes to what we expect from our items and how they're developed. And we're going to make sure that all of that is done before they even see an examination. This process actually is pretty lengthy. These we are looking at panels of somewhere between 8 and 12 people for your item writers and for your review panels. They're made up of individuals from all across the EMS community, including paramedics, EMTs, appropriate level, of course, state EMS office officials, individuals who are working in practice in the field, providers. Once these items are produced and then vetted, they are unscored. They're piloted on the examination. We put them on the exam and they're presented to about 400 individuals on the examination in a live environment. Getting these wrong or right does not impact the score for the candidate. This is a situation where we're just collecting data on these items to try and figure out if these items are good or not. Are we going to be able to use them, or are they going to be discarded? This process is going to estimate the difficulty level of each item and determine whether or not they discriminate against high or low performers. Now, when I say discriminate here, in testing, when we say discriminate, we mean, does this item differentiate between a high performer and a low performer? What we don't want the item to do is to have bias. We don't want it to negatively impact a specific demographic or population group, right? So what we look for in an unscored item is we want to make sure during our piloting process that we're estimating our difficulty level, we're determining whether or not it's discriminating against high and low performers, and we're looking for any potential bias. After the items go through the piloting process, they're exposed to 400 individuals. If they are deemed up to snuff, they will go onto the examination as a scored item and continually monitored. If not, they will go back and go through repiloting. After that, a passing standard is going to be determined, and that's a data-driven approach that's SME guided. So we bring in, again, external volunteers and subject matter experts to come in and take a look at the examination and say, hey, look, what should the standard be? They tell us, and we set up that process, and it's psychometrically approved, and the board oversees this process. And so that's how it kind of goes down there. It's not a one and done event. It's continuous review. Updates to content are continuously happening in EMS. I've been in the field for, I don't know, 14 years now. And I can say that we've had a lot of content changes, and the examination is constantly reflecting that. Feedback from providers and external stakeholders is taken into account based on factors, as we're kind of right now going through the ALS redesign process based on feedback. And then quality audits are continuously happening throughout this cycle. Does anybody have any questions?
At this time, there's no open questions.
So item basics. So what is an item? An item actually is a statistical term, and it refers to a single data element. I like to use the example of an airport. So it's 11:30 at night, you're on the red eye, you're flying back from your conference, you're trying to get home. And everybody's kind of on edge. You bump into somebody and maybe they say a rude word to you, maybe you say a rude word to them. It's one interaction. You can't make a determination about that individual's value system, their beliefs, what they're like based on that one kind of weird encounter in a stressful situation, right? You need a body of evidence or a group or a data set. That's where the test questions come in. That's all of our data sets, and they're combined into a test form. And that test form is what's going to give us the ability to determine whether or not the individual who is taking the examination is meeting the passing standard. A test question has a stimulus at the top, which is going to prompt the candidate to perform a behavior or to respond to the question. And then we're going to record that and make the determination. So test form, what is that? It's a grouping of items. It's sculpted based on that test blueprint that we talked about earlier. That test blueprint being with the domains we talked about. There's 5 domains: ARV, cardio, med-OB, GYN, trauma and ops, right? And we have percentages that come from each one of those domains. And then estimated difficulties for items that need to go in the test forms. And the psychometrics team does that. And they sculpt all those together so they're reflective of that blueprint and of that practice analysis that we talked about before. We're going to use this test form again as a data set to evaluate the competency of those candidates. Here's the anatomy of an item. Here at the top, you see that stem. In this particular test question, you have a 54-year-old patient short of breath with nausea, chest pain after a basketball game. The patient has a blood pressure of 84/60. What's the most likely cause of this patient's condition, right? So at the top, you have a stem. I refer to this thing down at the bottom as a lead-in. That's basically the prompt. And then down at the bottom, you have your options. You have your keyed response here in green, and then the foils or distractors are your incorrect answers. And this is a classic multiple choice question. So here it is in practice. Which of the following signs or symptoms is associated with asthma? And then the candidate would simply select the correct question. There's always going to be 3 here that are incorrect and 1 that is correct. This is the multiple response item that you may have heard about. You're probably already familiar with this. This is our exam now. We've been talking about this for a couple of years, I believe. So which of the following signs or symptoms are associated with asthma? Select the 3 answer options that are correct. And so you have coughing, stridor, wheezing, shortness of breath, ascites, and slurred speech. And then they would have to select the 3 here. We're always going to have either 2 or 3 correct answers here and 3 distractors or foils. Some of the future item types that we have coming up are build lists, sequencing items, drag and drop, and checkbox items. I have a link here, and we'll go ahead and drop that in the chat at some point for you guys. You can click on that and take a look at those. We have some good videos on these test questions and these items and what they look like, and give you an idea of how to put those together.
Okay, John. Joel Demers asks, John, in a multiple response item, is partial credit awarded for less than a perfect response?
So that's a great question, Joel. So the question being, hey, look, if they get one of these right and the other one wrong, is it all wrong or all right? And so no, right now it's dichotomously scored. They have to get them all correct. And that's one of the reasons why we're telling them in the STEM how many they have to get correct. that shows, the research shows that that is going to be something that improves their performance on the examination when they get that information. So, and to be fair to the candidate and to make sure that they understand how many they have to get right, we make sure to put that in the STEM. That's a great question.
Sarah Brown asks, when can we expect the TEI questions to be included in all exams?
So we have TEI items on the examination right now, the forms of multiple response test questions. And then later this year, we're actually going to start rolling out the new versions of the TEI items. And once those goes live, we'll make sure to get that out to you in terms of that. At CreditCon, I believe we're going to be there. We're going to be at NAEMSE as well at the conference, and we're going to be just demonstrating and showing those items off.
Sean Pochik asks, why drag and drop and matching, etc.? It seems distracting.
So, hey, these items, why are you using these items and these items types? So this is based on some of the feedback that we've gotten from the community, as well as some of the research that's out there. So before an item is selected, an item type, not just the test question itself, but the actual item type that we're going to use, classic multiple choice or multiple response or what have you, the psychometricians have to determine, okay, what is it that we want to measure and what's the best way to measure that? And so the selection process for that is selecting and verifying and validating that those test questions are performing the way that we need them to. To your point, hey, it seems distracting. There's a lot of movement. There's a lot of stuff going on here with these. How is that going to impact the candidate? Research shows that these candidates do very well with these innovative item types and these technology enhanced items. There's been several studies. I know Dr. Applegate has talked about this before in terms of the TEI items, how they actually, in many cases, will enhance or improve the candidate's performance because there's a little bit more face validity there. It feels a little bit more authentic to the candidate. We actually have a little blurb on our website, and we'll probably link that to the chat at some point to get that information to you.
Thanks, John. Crystal Reynolds asks, for the select all that apply questions, do the questions always state how many to select?
Yes, they do. That is a great question. And we're going to talk about select all that apply a little bit later. But we don't ever have select all that apply or what have you. It'll always tell them, hey, look, select 2, select 3.
And that is all the questions for now, John.
All right. So developing test questions. What is our goal? So the National Registry, what is the goal of the National Registry when we're developing a test question? And I think this is a critical question that a lot of people kind of ask themselves, and I ask myself, and we ask ourselves all the time, well, why are we doing this? It's because we want to make sure that somebody has got the competency to be practicing out in the field safely, right? And so in order to do that, we need to examine higher order thinking. Candidates who know content should not have barriers to answering the question correctly, right? That's really the main thing. Candidates who know content should not have barriers to answering the question correctly. So the goal of good item development, both in your program and at the National Registry, should be to reduce construct irrelevant variance and construct underrepresentation. Those are big words. I'm going to talk about what they mean. I'm going to break them down in the next couple of slides. But the key takeaway from this slide is the goal in developing our test questions is to make sure that we're removing and eliminating barriers to answering that question correctly. Because at the National Registry, we don't want to know how good you are taking a test. We want to know how good you are being a paramedic or an EMT or an EMR or an AEMT. So construct irrelevant variance, breaking down that word or that phrase into its component parts. What is a construct? That's a term from psychology. A construct refers to a knowledge area, a piece of information that you have kind of in your head. And so a lot of people ask, well, how do you measure somebody's what they know, right? You can't take a tape measure out. You can't take a ruler out. You can't examine, right? Do a little biopsy of the brain and figure out, okay, let's weigh or measure the paramedic side. We have to cause them to do some behaviors. That's the construct, what they know about EMS, right? Things that are irrelevant are things that don't matter to the things they know about EMS. Some examples that talk about bias, readability, how good they are at guessing and taking tests. Those things are not relevant to how good they are at practicing as a paramedic. And variance, this is anything that modifies or alters or changes their behavior. that isn't related to the construct. So construct relevant variance is simply, this is stuff that's in your test question that doesn't need to be there because it's going to confound your candidate or your student in your program. So here's some construct relevant variance. We're talking about bias. If it doesn't need to be in the test question for the candidate to answer the question correctly, you'll need to take a look at, gender or sex, race, ethnicity, nationality, the region. Are those things required for the answering of this question to answer correctly, or is it something that's irrelevant or distracting? Give an example of this, just off the top of my head, a 25-year-old patient or a 25-year-old male patient has penetrating trauma in the chest. What are you going to do next? Whatever. The fact that the patient is male is not really relevant to the treatment for this patient. So you would not put that in there. If there's a reference to ethnicity or nationality, and it's not required for you to get the answer correct, then don't put it in, right? I have patients' medical history in here as an element of bias as well. And I know that might sound a little weird, but when you think about like how you describe a patient in your STEM, think about, do I want to be known as, the diabetic, or am I someone who has a history of diabetes, right? So you can oftentimes bias test questions against people who have these conditions by simply saying, hey, a 24-year-old diabetic, rather than saying a 24-year-old patient who has diabetes, which would be a more appropriate way to do that. Some candidates do find that distracting, and anytime you engage a candidate's short-term memory while they're trying to take the test, i.e. they're kind of having to think about what's on the screen more than they really should be, because there's some element of bias in the test question, it's going to impede their performance. Something to think about there. Here's some other examples. So scene safety is a really good one that I like to use for bias, because not everything is universally scary. Stranger Things just happened to come out. Stranger Things, I love that show. It's my favorite show, Stranger Things. So they just dropped the new season. If anybody wants to go see it, here's my Stranger Things plug. You're welcome, Netflix. So Stranger Things, I think it's a little creepy. I like it. I love it. It's a little scary. And I like to watch it at night, but I'm a little nervous. But I know people who would not be fazed by watching Stranger Things at all. And so that's an example. Barking dog is one too. That can be a bias thing. I have a dog. My dog barks. It doesn't scare me, right? But it may scare some others. So if you're writing a scene safety situation into your test question, just make sure that it is universally scary for everybody. Manhole covers. This is a regional bias example. Up in Alaska, they don't really have manhole covers because the ground is permanently frozen in a lot of places up there. So when you say, hey, look, this person fell down through a manhole cover, well, they don't know what that is because it's not in Alaska. Parents, mom versus dad, you're inadvertently introducing potential bias there with that. Different caregivers, for instance, can take on different roles on scenes based on their gender or sex, I find from different item writers or developers. Children, girls versus boys. I notice item writers will be biased in what injuries or what presentations girls have versus boys have when they're children. Same for parents as well. Relationships and husband and wife, and introduces just a lot of different things that kind of can confound candidates and make them not answer that question as best as they could. Also down here at the bottom, I have deal with. I really like to use this one because it's a really good example of how sometimes your lead-in can introduce bias inadvertently. So I'll give an example. There was a item that I was looking at that was going through an internal review, and the item had something to do with a behavioral emergency. And the lead-in was, how would you deal with this patient? And I don't think that the item writer was intentionally trying to introduce bias into the test question, but that's when you're thinking about it, when you use the word deal with, there's a certain connotation that's there. It's like a burden almost, whereas, how would you treat or how would you manage or assist this patient? So that has got to be something you consider. So construct relevant variance bias. Here you have at the top, 34-year-old male is drunk and unresponsive. There's a barking dog on scene. The patient's wife is on scene and informs the EMT he is a diabetic. How should the EMT deal with this situation? So here at the top, you have an individual who has who's a male, right? So there's some kind of potential bias there. with, our males more prone to becoming intoxicated. I don't know. But that might be something that one of your candidates or students thinks about, right? Because you got to kind of put yourself in their position when you write some of this stuff. Barking dog might not be universally scary. The patient's wife is on scene. And here's some interesting grammar stuff happens with this one, because the patient's wife is on scene and informs the EMT he is a diabetic. And because we're not using the word the patient here, we're using pronouns, male, female, he, her. It actually kind of looks like it's like the wife is now saying, hey, look, EMT, you've arrived on scene, now you're diabetic. So how would the EMT deal with this situation? A cleaner version of this, at the bottom, you have a 34-year-old patient showing signs of intoxication and is unresponsive. It's a little bit more objective, removes the gender and sex out of that. You have a large crowd with weapons. It's universally scary. I don't know a lot of people who like to hang around large crowds with weapons, and they're gathered around the patient. The patient's spouse is on scene and informs the EMT the patient has a history of diabetes, which is a very appropriate way to give that patient that medical history in that stem. And what action should the EMT take next? So we're not using that to deal with. And so that's an example of how basically the same information in two different stems is written in a very different way to be more objective and neutral, to eliminate bias. And again, this is stuff that we're doing because it negatively impacts candidates. People, when this stuff is put in, the performance of those candidates is not as good. They're not able to answer those questions as correctly as well. And so that's why we don't want to hurt our candidates by having that introduced. So readability is another one to be thinking about. Obviously, the National Registry examination is written down, so you have to be able to read it, but it's not we're not testing how good of a reader the candidate is. We're testing how good of a paramedic or an EMT they are, right? And so what we want to make sure we're doing is we're making sure that the readability of the examination is accessible to the provider. So for paramedic, we're talking about 10th grade reading level. For EMT, we're talking about 8th grade reading level for our examinations. Now, when you're talking about readability, something that you should think about is the words that you're using that are medical terminologies are going to make the readability higher because they're longer words. They have more syllables in them. They're more complex. And so what we do when we do our readability analysis is we remove those from the analysis. We don't factor those in. And the reason being is because the paramedic or the EMT should know those words because they're related to the construct being what they know about EMS and what they know about care and practice. They don't need to know about, the word defenestration to throw out of a window, right? That's not really relevant to EMS care. I can just say that the patient was thrown out of a window. I don't have to, drop a kind of an archaic word that really isn't in common parlance anymore. When you engage the short-term memory, as we talked about a little bit before, of that candidate, it's going to increase their cognitive load. The cognitive load is anything that they have to think about extra that's going to impede their ability to get that question right. And so when you start making things more challenging to read and you're using larger words and increasing the readability of the test questions, it's going to impact their performance. And so we want to make sure that we're keeping the items clean. One of the things that confounds readability in a test question is oftentimes information is presented in the STEM without context. And a lot of people who are new to item development or have never developed items before, they kind of get a little frustrated with that piece. So I'll give you an example. You are managing a patient who has some kind of condition and you give a blood pressure. And one of the things that I often will see is, hey, how did they get that blood pressure? You need to write down, you need to describe the act of getting the blood pressure. What size was the cuff? Did they do it appropriately? There's so many things that could go wrong in a blood pressure measurement that could skew the results. How do we know that this blood pressure is correct? Because you haven't described how you obtained it. We're not going to, whoever's writing the examination, and this should go for your program as well as for the National Registry. We're not going to put in information into the test question that is like, if we tell you what the blood pressure is, that's going to be what the blood pressure is, right? And so we're not trying to trick you up on that kind of stuff. So we told them in the STEM that's the blood pressure, and we don't need to kind of describe it. I see the chat has got some notifications going up. I know we're not really due for a question break right now, but I do want to get to some people if you have questions. Emily, do you have some questions going on right now?
So we have a question from Michael Gallo. He asks, how will these TEIs affect candidates with documented 504s?
Okay. So I'm not familiar with a documented 504, but I'm assuming that is that an accommodations question?
I believe so, yes.
So if that's like an IEP or an accommodations type question, so the answer is that we review accommodation requests on an individual basis, and the same process will happen. So if the candidate qualifies for extra time, or if they need a reader or what have you, if they qualify for those things, then they will be granted. And so the introduction of the TEI will not necessarily impact them at all, actually.
Okay. And not a question, but more of a comment from Brian Webb. He says, we have manholes in paved streets in Alaska. I do want to point out, John was referencing a real world example of a issue with one of our test questions, in that a candidate did not know that about manholes, but I'm sure that there are many places in Alaska that have them.
Yeah, Brian, I don't know. So what happened was, I'll tell you, this is a real thing that happened, right? So we're doing an item panel. And a gentleman flies down, he's in the panel, and he's like, what does a manhole cover? And we're like trying to trying to describe what a manhole cover is and the paved streets and everything. And he's like, I'm from Alaska. We don't have that where I'm at. So like, I think like further south around Anchorage or stuff like that. And I'm not sure where he was from, but that was something that popped into my head, was, hey, because it's interesting to me. Like, if, for instance, I'm from New Orleans, and if I wrote a test question, I said, the patient was found on the neutral ground, everybody in New Orleans would know what that is. But nobody else outside of New Orleans would know what the neutral ground is. That's our word for them, like the median. So it's kind of like a localism or kind of a regional kind of thing that might bias a test question against others, like a 504, for instance, or like a 10 code. You wouldn't put that in because 10 codes aren't universal. So, but yeah, interesting. I have to pick your brain on that a little bit, because he swore up and down there were no manhole covers there.
Okay, so the next question is from Charles Hill. He asks, are there any resources that are available to educators that will allow us to write similar TEI questions?
Yeah, so hey, look, are we going to be providing educators resources to determine whether or not how to write these things, right? And so Dr. Paul Rosenberger is actually working on some projects right now that's going to create some tools that you guys are going to be able to use as educators to develop these things. I know on our website right now, we have some YouTube videos on what these things look like and kind of how they work technically. But I will say that the fundamentals of item development are kind of the same across all the test questions. When you start talking about TEIs, really the situation is kind of like, just what are you asking the candidate to do becomes a little bit different, but how you're writing the test question, kind of the similar thing. You're looking for like concise things, short-term memories. You're not really engaging that, right? You want them to keep it to the point, keep the cognitive load down. So it shouldn't be, it's not that much different than actually writing a multiple response or multiple choice. It just is another format that actually gives you a little bit more flexibility and a little bit more options to kind of get in there and ask some questions in really good ways, actually. Yeah, but no, we're going to make sure that we get that information out to you guys. Paul Rosenberger, and he's going to get some stuff for us, and we're going to send that out.
Thanks, John. So the next question is from Marvin Helmker. He asks, can you explain how the use of male, female, dog, etc. is considered biased? If this is now the standard, should we also eliminate any such references in documentation when writing patient care reports?
Yeah, so to the patient care report aspect, obviously, that's a great question. Yeah, so the National Registry doesn't really have anything to do with in terms of patient care or patient care reporting. There may be good reasons to include the gender or sex of the patient in a patient care report, if for none other than identification purposes, to make sure that you have the right patient, so medication errors don't occur. In a testing environment, the reason that you don't want to introduce gender or sex unnecessarily is because it can bias test questions. I'll give you the example of it's kind of a heavy topic here, but non-accidental trauma or domestic violence. You can oftentimes have bias introduced into test questions by introducing a gender or a sex that doesn't necessarily need to be there in order for that candidate to get the question correctly answered. The reason being is some people may have their own interpretations of what that situation might look like in terms of who's involved and what their relationships are. You remove those relationships and you don't introduce that bias. You remove the subjectiveness, so to speak, in that test question. So in a testing environment, what we're trying to do is remove subjectivity and keep it as clean as possible. If it's relevant to the test question, of course, the gender or sex would be included in the test question.
Okay, Matthew Johnson asks, what about using race, nationality, etc., to help lead the test taker? For example, a 25-year-old African-American patient is complaining of joint pain and acute chest pain. What condition could the patient suffer from, knowing that sickle cell affects African-Americans?
Yeah, no, that's absolutely like, so if you're saying, hey, look, this is clinically relevant and it needs to be in here in order for the candidate to get it answered correctly, then absolutely it needs to be in there, right? The point, to kind of circle back, the point I was kind of trying to hit at is that if it's not relevant, it probably shouldn't be in there. But if it's critical in order for them to get that question correct, then absolutely. Because there are different populations that suffer from different diseases that are different ethnicities and nationalities and so on.
Okay, thank you, John. So this next question is referencing a previous slide in which the example was a 34-year-old intoxicated patient. I don't know if you want to hop back to that slide to answer this question before I read it.
I don't know if y'all want to see me hopping around. Okay, there you go.
Okay. So this is from Alyssa Cahoon. She says, for the question portraying a 34-year-old intoxicated patient, the second example has a significantly more impactful distractor by noting a large group of people with weapons in place of a barking dog. The other changes made to the initial question made sense in reducing bias through changing the distractor, though changing the distractor seems to complicate the question. Did I miss the intent behind the comparison?
No, that's a great question, and I'm glad that you asked that. So remember, when we're trying to remove bias and we're trying to make sure that the question is interpreted universally by everybody in the same way. And so for me as a dog owner who has a German Shepherd, my dog barks all the time. I use this as an example because people have pets, but there are other more subtle challenges with scene safety. But, so if you're familiar with a barking dog, it may not be scary. The dogs bark, my dog barks. Sometimes my dog barks at me. It doesn't make me nervous necessarily. So if I'm looking at the test question as a candidate and I see a barking dog, am I going to recognize that this is an issue for me on the scene? And that's kind of what the change was there. There's no, you can use a dog as a scene safety challenge. Just make sure that when you're using the dog, you're contextualizing in a way that it'll be scary. And so that's kind of the point I think I was shooting for when I did the barking dog versus the large crowd. To your point, though, large crowd, lots of weapons. Everybody's really afraid of that. Really obvious, really bright sort of thing. So that's kind of what I was shooting for there. I hope that answered the question.
Thanks, John. We have no other open questions at this point.
Okay, great. Because so we were talking about when we left off, we were talking about readability and the challenges is that I want to reemphasize 10th grade for paramedic, 8th grade reading level for EMT. And, we're looking at the terms that are not related to the content on the exam, the EMS practice, right? We're looking at the terms that are like to finish straight and throwing it out of a window, stuff like that. Things that are very syllable heavy and add to the confusion of the sentence or the stem without really adding anything to the content. And then we talked about the blood pressure example. So here's some examples of readability issues. So overly long stems. You don't have to write 1 or 2 word test questions all the time. A lot of times I see people take this to heart and they really get really super clean with their test questions. They wind up with a bunch of stuff that's like 1 sentence or 2 sentences. It doesn't have to be that extreme. But if you're sitting there and you're by the end of the sentence, you're like, wow, or by the end of your stem, you're like, wow, that's a lot. Might want to cut it down a little bit. I like to use a kind of a guideline. This is a guideline, not a rule, of somewhere between 3 to 4 sentences. And I'm not saying that those are 3 or 4 word sentences. It can be a little bit longer, but something around there. If you have 5 or 6 sentences, but it's still readable, it's still pretty easy to read. That's okay. Overly long answer options also are confounding. There's opportunity usually in those when you have these answer options that are really lengthy to kind of cut those down and put them back up into the stem. Poor grammar. I have Grammarly because my grammar is poor. That's why we have an editor on staff who looks at all of this stuff for us. If you don't have that, or you don't have ability to look at Grammarly, always have somebody proofreading your exams. I always have like I just write documents. I have somebody proofread stuff, so it's critical to have it on the exam. So make sure your grammar is good because that's going to negatively impact things for your candidate. Complex vocabulary that's unrelated to the construct. We talked about that. And the window dressing. That's kind of what I was referring to with the blood pressure stuff is just, if the detail doesn't need to be there, don't put it in necessarily here. And so here at the top, we have a really long stem that's got a lot of errors and issues with it. And it's a kind of a exercise in creative writing, right? We got the wind and it's howling around and the rain is swirling. There's driving sheets everywhere. It's the EMTs approaching the patient and lightning's cracking in the background and the patient's lying on the ground near an old bent over oak, right? The downpour is hitting the roof and he can't even hear the radio. The patient's got an axe in their chest and a bystander is looking on in horror. They're screaming and it's up to you to act. How are you going to proceed? All that simply can be boiled down to a 26-year-old patient is supine and unresponsive with an axe in their chest. What is the first action an EMT should take, right? You don't have to necessarily paint a big picture, just get into facts, so to speak. I do want to stop here just for a minute and just kind of reemphasize everything that we've talked about so far in terms of how to develop an item is all about things that are actively hurting the candidate. So everything we've talked up to this point is stuff that if you do this, the candidate or the student, in your case, in your program, will be less successful in answering that question. So this is an example of an individual who knows the information, but because these things are in the test question, they're not going to be able to answer this successfully because these things are creating that construct irrelevant variance that we talked about before. And so all of this is designed in doing this to help your candidate or that student to pass the examination. We make sure that we do all this stuff to help to make sure that they pass. So the next stuff that we're going to talk about is guessing. And this is the stuff that isn't going to hurt them, but it will reduce the ability of the test question to discriminate between those high and low performers on the responses. And so this is guessing or test wiseness. And these usually will come about with like a pattern that is going to expose the key response. So we'll talk about some of those patterns here in a minute. But essentially, you have what we refer to as a clang association, a 3-to-1 answer option, a 50-50 split, implausible distractors, and made-up terminology. All of these things increases the odds that somebody who doesn't know the answer to the test question is going to get the test question correct. So I'm going to go into each one of these in the next couple of slides. So a clang association is when the keyed response to the correct answer is in the stem. And so here you say, which of the following signs or symptoms are associated with asthma? Select the 3 answer options that are correct. You see the top is asthma there, makes it pretty obvious which one of those is going to be the right answer there. A 3-to-1 answer option. Now remember, this is a pattern. So we have 3 answer options that have a pattern and the keyed response does not fit that pattern. So it makes that keyed response stick out like a sore thumb, right? And so here we have asthma. And what makes asthma different than the other 3 answer options is that asthma doesn't start with the letter S. And a perceptive candidate, somebody who is extraordinarily good at taking tests, will notice that pattern and try to select the answer that looks different. And so when you're developing your test question, be thinking of that. Now, I use the letter S in this, but it could be some other pattern that could be the same. Maybe everything's got 3 words in it and the keyed response has only got 1 word or whatever pattern you can imagine. Now, this is fine to have a 3-to-1 in here in your test question if, say, asthma was an incorrect answer. So if asthma was the incorrect answer and say Strider was the correct answer, it's a 3-to-1, but it's away from the correct response. And so that's okay. Now, if you do these things that we're talking about here that increase the ability of a candidate to guess the answer correctly, it's okay if it happens. It's just going to negatively impact your ability to determine whether or not that candidate is above or where you think it's at. And the reason I say it's okay is it's because it's not going to hurt anybody for your program. We make sure that we don't do these things, but like if you're really struggling in your program with a distraction, you're like, man, this is a 3-to-1 and I really am trying to get this to be something different because I heard that we're not supposed to do those. it's not hurting anything. So this is just helping people who know how to take the test really good because they're good test takers get it right. That's something that's not good, but it's not hurting anybody. 50-50 splits, increased, decreased, decreased. This isn't bad per se if you can avoid it. I mean, that's okay too. The only problem with this is if somebody has partial knowledge of this, they can eliminate very quickly half of the answer options, and it just becomes like a 50-50. You flip a coin, and increases their ability to guess. Which of the following signs or symptoms are associated with asthma? These are implausible answer options, right? So halitosis, alopecia, those things are not necessarily, someone with asthma may have halitosis, but that's not a sign or a symptom that you would noticeably associate with asthma. And made up terminology. Again, that's something else that's going to help a candidate who does not have the knowledge to be able to get this correct, because it's just made up. They'll recognize it. Like intrinsic hypereunia, double lumen autourea disorder. Like those aren't really things that we deal with in EMS. So this also is kind of out of scope stuff too, right? So if you got something on your exam that's out of scope, they'll recognize it or should recognize it as out of scope and immediately be able to knock it out of the park in terms of being able to eliminate that option. Or if a word looks weird, somebody who's a good test taker will look at a weird word and be like, I'm not familiar with that, and eliminate it because they don't know it. That's oftentimes something they'll do. So other things to avoid, if you can't reference your content. Now you're referencing your content from your curriculum, right? And so you're using your textbooks and your AHA guidelines and those types of things. And so make sure that you can defend your answers in there. It's always good to have a rationale written out. So when you create a test question, always make sure that you write out a rationale as to why it's correct and why your answer options are wrong. We do that at the National Registry for our test questions. We make sure we have rationales written by the item writers. And true false answer options are something that we avoid. You can use them in a formative exam. The reason we don't use true false isn't because true false aren't good per se. It's just there are better ways for us to do what we need to do in terms of our test questions rather than using a true false. Humor. I've heard educators in my career as a student tell me that they like to put humorous answer options or things into their test questions because they feel like it kind of lightens the mood a little bit and helps people out, kind of reduces the tension or anxiety. Actually, it doesn't. It actually negatively impacts your low performers. So the individuals who are kind of on the borderline there are going to be most negatively impacted by this. Your high performers aren't really going to be negatively impacted by the humor stuff because they're well above the competency line for what you're shooting for your exam. But for your lower performers or kind of borderline folk, this will negatively impact them. I see the QA lit up.
Yeah, it's not a question, just a comment from Brian
Gotcha.
Webb. He said, I liked the aspect of references and defensibility that were required when I was on the paramedic exam writing team. I learned a lot from the experience.
Well, thanks for that comment. Yeah, we work really hard to make sure that we have the stuff all kind of squared away when it comes to the rationales. And there's not a test question that goes on the examination that doesn't have on the back end of it appended to it some kind of rationale or reference there to make sure that it's correct. And then we also talk here about negative stems. And negative stems are essentially things that are like, which of the following should you not choose? All of the following except those types of things where you have to flip the logic of the test question in order to figure out what the test question is asking. And the reason those are bad is because it's not really related to the construct we're trying to measure, right? EMS, where it's more related to like how good are you at taking a test. And we want to avoid the negative stems. And so we flip those to be positively inflected. So construct under representation is another thing that you want to avoid when you're building out your test forms or your exams. That means essentially is your test, you think your test is testing something, but it's not because you don't have enough of the content on your test to make a determination. I'll say that again because I said that a little wonky. Basically, what you're saying is the stuff that's on my exam is not representative of the stuff that I'm trying to teach. It's not lined up with my objectives. Some examples of this are trivial content or items that rely solely on recall. I have an example of this here. What is the most commonly sized portable oxygen tank? Right? Who cares, right? Is that really going to impact your ability to be a good provider? That what a commonly sized oxygen tank is? No. For the certification examination, what we're looking for is are you safe to practice? And for your formative examinations, or maybe you have something in your protocols or something at your agency that you work at, where maybe this might be important for some process that you have to know this. That's something. This is just an example of that. So, and notice, go back a slide. It said items that rely solely on recall. Every item is going to have some element of recall to it. Every test question you write, there's going to be something that is going to be just downright rote or definitional. But the item shouldn't rely solely on that recall. We're trying to hit that higher order thinking. So we have an opportunity here to pause for some questions. Any comments?
Yeah, so from Robin Alvarez, shouldn't any test or quiz question or any type of validation be based off of a reference like an SMO or policy?
So, yes. So is she asking about the oxygen tank question?
I'm not sure. She needs anything else?
So for the National Registry, our examinations content is sourced from the practice analysis. Again, that snapshot of EMS providers that are working in the field. From that practice analysis, it generates a list of tasks, knowledge, skills, and abilities. And those tasks, knowledge, skills, and abilities are then analyzed, and that test blueprint is going to determine how much content from what areas need to go into an examination, right? So we're talking about those 5 domains that we talked about with the ARV, cardio, med-OB, ops, trauma, and those percentages. And so that's where our content is sourced to, and that's how we validate it through the practice analysis. And we make sure that the content is referenced to materials from the Paramedic Guidelines Consortium or PGC, AHA. We look at materials with textbooks and those things. But there's a various multitude of things that go into making sure the items are referenced on our side of the house. For your program, as you're referencing your materials, you absolutely should be referencing materials. But remember, we're nationally focused. Our program, our certification organization is nationally focused. And so if there's like particular SOPs, you said, or protocols, where you have a protocol test or something like that, and you're trying to determine whether or not an individual has memorized a protocol test, well, then it might be appropriate in that use case to use a rote question like, what is the most commonly sized oxygen cylinder? Because you're trying to assess whether or not someone has memorized the protocol book. But that is not the purpose of the certification examination for the National Registry. But if you're developing an exam and that is your goal for the test, then that would be appropriate.
Yeah, John, Robin clarified that her question is about the conversation about questions that are not based on a reference and would therefore not be defensible, right?
So if a question was unreferenceable, would it be defensible, right? And so we would not use a test question that we would not be able to defend, or we would not be able to cite or have a reference for.
Thanks, John. The next question is from Chris Petrello. He asks, how many times should an exam be attempted at minimum before an item can be declared valid?
That's a great question. So, hey, look, the question is, how many times does an item have to be responded to before it can pass piloting? And the answer is 400 times. 400 times. So that's 400 unique exposures. So that means 400 unique candidates have taken a look at that test question and responded to it. Once it hits that 400 times, it comes off of the examination and it gets analyzed by the psychometrics team. And the psychometrics team takes a look at it because the content side of the house has already validated it, right? The external subject matter experts have done their work. The internal subject matter experts have kind of make sure that the external subject matter experts have done their work. And so now it's with psychometrics, and psychometrics is going to try to determine whether or not it's, discriminating against that high and low performer, whether or not it's got that the evidence that we need to make sure that it's, is there any evidence of bias on this exam, this test question, and we're looking to determine whether or not, it's fitting our parameters and our policies. And so 400 times it goes through that process. If it doesn't pass that process, it doesn't go on the exam as a live support item. We either reconfigure that test question or we throw it out.
Thanks, John. The next question is from Julie Jordan. She asks, how is NREMT handling the fact that multiple services are getting away from AHA management in regards to cardiac arrest?
Hey, yeah, so that's a great question. So I think that comes down to a couple of different things. So lots of agencies are saying, hey, look, we think that, there's maybe some variances to the American Heart Association protocols or guidelines that we want to use in our organization. And, at local practice and regional practice is always going to have some little variances to it. And that's okay. Our examination is tailored to the national standards and national scope of practice. And so what we look at is, because AHA is our ILCOR representative for the United States, that's what we look at. So they go back to the ILCOR and they kind of get us that information from that body and bring it back to us and disseminate it. And when I say us, I mean the United States, not National Registry in particular. And so that's kind of what we look for there to the national standard. Yeah. So if the AHA makes a change, we certainly will follow that.
Okay. The next question is from Kyle Atkins. He asks, is the number to evaluate the 400 people exposure, does that change or is it a fairly static number? Essentially, if we're writing questions in our programs, would our number be to evaluate, would our number to evaluate be lower, or is 400 the same across the board?
So it depends on how, so I'm a guy who knows a little bit about psychometricians, but I'm not a psychometrician. And so we're getting a little away from kind of where my expertise lies. But I would say that, 400 exposures for a program would be a significant, to your point, would be a significant lift. I'm not familiar with too many medic programs out there that would be able to validate test questions using 400 exposures in an environment like that. That's going to be a decision that you'll have to make at the program level in terms of what is kind of good enough for us in terms of if you're going to look at things psychometrically and you want to develop a psychometrically sound examination, it'll be a challenge. I encourage you to do that. To be frank, I don't know the answer to that question. And if you put your name and information in the chat, I can get back to you on that. I know that we use 400, but I know that that's not an attainable goal necessarily for all programs.
This is a question I can answer, John. Terry Gotti asks if this webinar is being recorded and if it'll be available to share with their instructors, and the answer to that is yes. It will be sent out after the webinar concludes. And Kyle said that pretty much answered my question. Thank you.
Yeah, and I will say, and we're going to get into this in developing an item in a little bit here, and I'm kind of getting ahead of the presentation just a tad, but you touched on kind of the point of some of the stuff I'm going to talk about in a moment here is like, if I'm in a program and I'm doing things in my program, what should I be doing? So it's a great lead in actually, what should I be doing to kind of try and emulate a little bit of what you guys are doing at the National Registry? And they're limited by resources and some of the things that you can do, but we can kind of brainstorm as we go through the rest of the presentation. Yeah.
And that is all the questions that are open at this time, John.
Okay, perfect. Thank you. So developing an item. Now that we've talked about a lot of stuff, right? So we've talked about the foundations of the life cycle of an examination, the examination development life cycle, and what all that has in it. And all those processes need to be set up and in place in order for you to have a good validated examination product. You need to have all of these kind of guidelines and everybody trained on these guidelines that we just talked about over the last couple of few minutes about, what is construct or relevant variance and how do we avoid it? And how do we prevent construct under representation, and how are we making sure that our test forms have enough of the content that we're looking for. Now that we've kind of talked about all of those things, we're going to talk about a little bit about, well, how are we actually going to go about developing an item? So content, where does it come from? We've talked about this already with some of the really good questions that you guys have asked in terms of, how do I source my content, or where does it come from? Obviously, for the National Registry, we're looking at things from a certification standpoint and a summative examination. And so our stuff is kind of built on the practice analysis and those things that we've kind of already talked about. Based on your program's needs, what that means is basically, what are you doing in terms of your curriculum? And that's going to be individual to each school in terms of what that curriculum looks like. I would encourage everyone, if you're not familiar with the document, to take a look at the education standards to kind of see kind of what things are nationally. Because, keep in mind that the National Registry is a national certification exam to a national standard. But if you're developing curriculum that has local or regional variances, and probably are, be looking at those things as you develop your curriculum. And your curriculum is really going to be your kind of your practice analysis, so to speak. Your learning objectives, your learning objectives are really going to be what you're writing your test questions to. We have a style guide. It's really nice, actually, because what it does is it tells us how to write a test question, kind of like the New York Times has a style guide, or Fox News, or whatever news service you partake in. They all have style guides. We have a style guide. AP's got a style guide. It basically just tells us, what format should this item look like. You can create one too. I encourage you to do that if you don't. It kind of lets your examination speak with one voice, which is really nice for your candidates, because as your candidates are kind of going through your exam and taking the test questions, it can kind of be a little confounding when you have one question that's kind of written in a certain voice, and you go to another question that's written in a completely different voice, and it can kind of throw you off. So make sure you're having some kind of style guide or some kind of framework, at least, to have some continuity between your test questions. It doesn't have to be crazy. It doesn't have to be big. Just a page or two with just some simple rules is a good start. When it comes to your content, you want to make sure that your key and stem are correct. We're looking for key responses that are 100% correct, foils that are 100% incorrect. There need to be, the information in the stem and in the options need to be current. I always like to use the example of the bellows, the old 1910s CPR where they had the big bellows come out, the drowning victim. You see the old school pictures of it, and they're right. We're not going to have that as a foil because it's not relevant, really not current. You need to make sure that it's in scope for that level. And when I say in scope, I mean to the in scope at the national level, because it's the national certification examination, of course. Following along with that NHTSA scope of practice model and making sure that you have referenceable material, you can support your assertion that this content is correct. There's another layer you can add to this too, right? So if you do all of this stuff, you're doing really good. But you can also, a lot of schools will have like an advisory board that they can kind of use, or there's volunteers and things like that from the community that may want to get involved and, take 10, somewhere between 5 and 10 people, get them in a room one day and go through your test bank, over a day or two, just kind of like we do, and say, hey, look, what can we do better with these test questions? And you can kind of mimic what we do in terms of our volunteers and they come in and do the item review. You can have your advisory board members come in or whomever, and they can help you out with it. When you create this STEM, you want to start with a concept in mind, kind of one application, or testing the application of one concept, right? And so when I say the application of one concept, really kind of like what you're writing to is your objective. And so you're saying, I want my student to be able to recognize and treat asthma. That's your question. Doesn't need to be more complicated than that. And when you tie it directly to your one learning objective, that gives you a really good idea of whether or not that candidate or that student in your case has the information that they need to be successful, right? Because if you start tying test questions to multiple learning objectives, you're not gonna know on the back end when you go to look at this thing, you go to score it. Okay, this person got tested, question 35 right, and 35 was linked to 4 different learning objectives. Which one does the candidate struggle with? How do I help that candidate? When you tie it down to just one, you get a really good idea of where that candidate is lacking. You want to make sure that there's enough information in the STEM to get that candidate to get to or student to get the answer correct. No window dressing though. We talked about that before. You don't need to paint the picture necessarily. You don't have to tell them what color the Honda Odyssey was. Just kind of the facts. And there was a car accident. This is what happened. These are the vitals. What are you going to do? Stuff like that. And just be as concise as you can with it. I do see looks like a couple of comments or questions popped up.
Hi, John. Yeah, so we have one question from Rob Walker. He asks, how often are items culled from the test bank and how many items are in rotation at any given time? These are questions I was asked by students.
So I can answer one of those things, and the other one is top secret, and I can't answer. So test questions are kind of continuously used throughout so once they're developed and they're scored, as long as they're, because what we do is we constantly review and analyze the test questions over the course of the examinations or that test questions life cycle, and we're constantly looking at it psychometrically to see if there's any drift or anything like that. And if there's some kind of quirk with it, we'll identify it in our psychometrics and stats, and we'll pull it out, and at that point we'll take a look at it and see if there's something wonky going on with it and repilot it. And that happens on an ad hoc basis, just as needed. That's not necessarily an exposure limit for that. And how many items are in rotation at any given time is top secret. I cannot tell you. Unfortunately, I can't answer questions about how many items are in the bank or things like that. I can tell you thousands and thousands and thousands. And that's about as specific as I can get, unfortunately, for test security examination reasons.
Thanks, John. The next question is from Danielle Petrie. She asks, is the style guide used by NREMT available for us to use?
Hey, that's a great question. And currently right now, it is not publicly available. There was some discussion about making that available. But what they are going to do, I think they're working on now, is they're looking at, what are some things that we can do to help support educators in terms of this kind of stuff, right? In terms of like, how do you write a test question? What does that look like? What does registry do? And if we wanted to do that, what would we have to do? And I know that Paul Rosenberger and his team are currently working on a lot of things with that right now. And so there's some stuff in the works. I can say that.
Great. Thank you, John. That is all the questions for now.
Okay. So answer options, concise, short. Answer options should have the appropriate number of correct and incorrect options. What is going to determine that, right? So it's going to be the answer options that you, the item type that you used. The item type that you use is going to determine this. So if you use a classic multiple choice item, you're going to use one keyed response and 3 foils. Or if you're using a multiple response items, there's 5 or 6 with the 2 or 3 keyed responses and your 3 foils. For that. So, that's kind of where that's going to be with those. The choices should be homogeneous. They kind of should look like one another, right? So if you have answer options that all kind of look like one another and they're all plausible, it's going to be harder for that candidate or that student to be able to guess that question correctly, right? They need to know the information if there's a large degree of homogeneity and continuity between those answer options. If they're not homogeneous, they should at least be similar. And if you can't make them similar, then make them all different. And that's kind of the top-down choices as you're kind of going through it. First thing you should do is make them all homogeneous. That's the ideal situation. They should all kind of look like one another and be there. If they can't be homogeneous, they should at least be similar, maybe the same body system. And if you can't make them similar, then make them all different. Just go ahead and just scrap the whole idea and start from scratch. Options should be related to the correct answer. They have to be related to the correct answer in order for them to work really well. Oftentimes, when my experience with panels, working with panels, you have 3 answer options come really easy. It's the 4th one that's always the most difficult, and that's where the reach starts to kind of happen at. But they should be related to the correct answer if possible to make it plausible. Your answer option should not contain multiple variables, and that's kind of weird to say without seeing an example of that. So on the next slide, I have an example of what a multiple variable would look like as an answer option. And I'm going to point that out on B here. Oxygen, administer oxygen, place the patient on a lung spine board, and then ventilate the patient. if you find yourself writing out like 3 different steps or 4 different steps, you're going to wind up in a situation where all of your answer options are going to kind of look like that. And it's going to confound your student or the candidate in our case. And what you really want to do is kind of break that down into each constituent part or component. So administer oxygen, place the patient along spine board, ventilate the patient, those types of things. And then kind of reconfigure your item to kind of make that work. What it really belies is it's a readability issue for the candidate. It makes it harder for them to get it right because it's more challenging to read here. So you have a 43-year-old patient, unresponsive, fell out of a tree, agonal respirations, blood draining from the nose and ears, which the EMT do first, right? So ensure the scene is safe to enter. You know, that's pretty relevant to that STEM, and that's plausible, right? B is kind of what we talked about with the too many variables. C, perform an inventory check using the beginning of the shift checklist. It's not a plausible thing. You would have done that before your shift, hopefully, knock on wood, right? Or document the shape and color of the tree. While mechanism of injury might be important, and knowing that a tree was the thing that the person fell from, the shape and color may not be the thing that we want to document or worry about in this step. Ordering the answer options. Actually, believe it or not, ordering the answer options is actually kind of influences how candidates respond to. If you do it in the right way, you can reduce guessing and test wiseness and the impact of that on your test questions. You can increase the readability too and decrease your construct irrelevant variance, which is again related to that readability. There are 2 types of ordering options that we kind of generally use, forced order and stair stepping. Now this happens when we can't get all of the answer options to be similar in length. So when we can't get them to be similar in length, we either use a forced order or a stair stepping. Forced order has got more to do with logic. So this is like an alphanumeric or ordered pair or process step. So if you have an alphanumeric, ordered pair, or process step, and you're looking at making these answer options, you want to make sure that they're in some kind of logical order, and it makes it easier for the candidate to process and get correct. Right. And again, this is something that we do in order to help that candidate get this answer right. So you see here in numbers, it's 10, 20, 30, 40, alpha, beta, theta, gamma. And it can be an ascending or descending. It doesn't matter. It just is one or the other. Stair stepping. Some options may be longer or shorter in length. It's going to aid the candidate's ability to respond correctly and decrease guessing. And really, I'll give you an example of what that looks like here at the top. And the reason it's going to enable somebody to guess potentially is you're either going to shoot for the shortest or the longest answer option, and it makes it a little obvious here. So like apply ice might be the right answer here. And it's like, okay, which one of these is kind of like the weirdest looking one? Apply ice is like way off from the other 3. I'm going to go ahead and select that. Where if you stair step it, it kind of disguises it a little bit. It's still kind of the shortest one, and it's still pretty obvious, but it does help a little bit statistically over time. Multiple choice versus multiple response. So with a multiple response item, we talked about this again, kind of hammering it home. 2 or 3 correct options, 3 incorrect options. The STEM should include the number of correct options. And the verbiage that we use at the National Registry is select the 2 or the 3 answer options that are correct. So that will always be at the end of the multiple response item. You don't have to use that verbiage. You can use whatever you'd like, but if you want to be consistent with our style, that's what we use. Select the 2 answer options that are correct. For the multiple choice item, there's the 1 and the 3 we talked about before. So we kind of talked about this already, but I just kind of want to reemphasize negatively phrased lead-ins, like including things like which of the following is not, what should a paramedic avoid. Right, these are negatively phrased stems. We don't want to do that again because it increases the likelihood of a candidate not being able to get the question correctly because they're trying to figure out what the item is actually asking. They're not focused on the content. They're trying to figure out what the question actually is. True or false, you can use it in your programs. We talked about that already too. It's not, there's nothing wrong with a true or false per se. There's just better test questions to do the same thing. When we're trying to measure different areas. True or false items are just really difficult to write well. They typically tend to be lower when you're thinking about like balloons or something on that taxonomy, but they're more like just straight up recall. Whereas if you can use a multiple choice or a TEI item, you're able to maybe have a little bit more flexibility. None or all of the above, we don't do that. We always are going to tell the candidate which one or how many they're going to select, and then any unnecessary superlatives that you might throw into a stem. So what makes a good item? A good item is concise and is accurate. The wrong answers in the test question are wrong, and the right answers are right. There's one concept. The content is relevant. The content is valid. The foils are plausible. We're not trying to trick anybody, right? The goal here is to make sure that if you know what the answer is to the test question, you get it right, right? That's what good test development is all about. It's making sure that candidates who know the test questions, who know the answers, can get them right. And so that we work really hard on that piece. And it's focused on application, right? And not necessarily your more rote stuff like the size of the oxygen tank, or what is the most commonly colored tag we use in our lockout gear at the agency you work for, something like that. Not trivia, so to speak, but stuff that's actually going to be a determinant in the patient's outcome. So with all that being said, before we get into item review and reviewing that, what other questions do you guys have?
Yeah, so the next question is from Sean Pachik. He asks, with the new testing format changes, are all or most multiple choice questions with 4 options going to be eliminated?
Oh, that is a great question. And the answer to that is no. The classic multiple choice items still have a place in the National Registry certification exam and will continue to be produced and deployed.
That is the last question for now, if you want to give people a few moments.
All right. So let's review a test question, right? So these are some examples. These aren't, I would just preface this by saying these were never live on an examination. This is an example that we wrote internally. It hasn't gone through like content review or anything like that. So if you spot an error or a clinical issue with it, just shoot me an email or send us a message and we'll take a look at it. So we got a 58-year-old patient reports dizziness with lethargy after ingesting an unknown substance. The patient has a history of smoking and hypertension. The patient's vital signs are 142/90 with a pulse of 132, respiratory rate is 16 with an SpO2 of 92% on room air. What has the patient most likely ingested? And so we have 4 answer options, right? I'm not seeing any 3-to-1s. I don't see a clang association down there. I don't see any 50-50s. They're relatively, they're all specific substances or chemicals. They're not classes of medication, right? So like, maybe you wouldn't say benzodiazepines and beta blockers. You have the specific medications there, digitalis, that's there. It's not some kind of classification, right? So that's another thing to look for. You have 3 classes of medication or chemicals, and then one that's the other one, right? So you're looking at all of these things, and a candidate kind of sorting through this would kind of be okay. Well, we got a hypertensive patient, they're a little tacky. It might be a caffeine thing. I don't know. So there you go. But that's the focus thing here, though, is it's clean. It's a little, and I wanted to kind of give you guys a kind of, this is a longer stem in terms of the words. You have I think what 4 or 5 sentences, something like that, but it's pretty concise and straightforward. There's no window dressing, and nothing too crazy about it. This is a multiple response question, and just kind of give you an idea what that would look like, if you were writing one of these for your own program. So you have a 12-year-old patient experiencing systemic uncoordinated muscular contractions and is unresponsive. What action should an EMT perform? That's the lead in that we talked about before in the stem. And then we have the select the 2 answer options that are correct down here. So, which one of those would be correct? And then you see the stair stepping here, right? Loosen any restrictive clothing on the patient. It's a relatively long thing. So we're going to start with that. Doing looks like we place the patient in a recovery position, insert an OPA. intranasal naloxone, restrain the patient, right? So you just, pick out the 2 of those that you think would work best and kind of go on from there. But that's, again, just kind of straightforward, no real bias in here, nothing extraneous information, no window dressing or anything like that. So with that being said, we have about 10 minutes left, and we have opportunity for questions. I appreciate, again, everybody's time, and thank you for coming by today. As you guys are typing in your questions, I really appreciate the opportunity to speak with you on something I'm very passionate about, because I'm kind of a nerd and I like test questions.
Thanks, John. Right now, there's no unanswered questions, so we'll give people a minute to get any questions in. Not a question, but you're getting many thanks in the chat.
I'll take it.
Okay, let's see. Okay, this is a question from James Gregg. He asks, does the length of a test have an outcome on success or failure?
Ooh, what a great question. Does the length of the examination have an impact on the candidate's performance? It's actually one of the reasons that we like the CAT exam so much, is because it reduces seat time for the candidate, right? They don't get as much test fatigue. So that's one of the things that the psychometricians have to factor in when they're doing their scoring, right? They have to think about the actual, like, how long are you going to put somebody who's butt in a seat, right? And so, when you're looking at exam lists, they're factoring in how many breaks do we need? How long is it reasonable for somebody to sit on and take the exam before we have to give them a break? And there's a lot of research and a lot of evidence behind the decisions that get made on that, right? So there's a lot of documentation and research that have been done in terms of like what conditions are good for candidates, what times are good for candidates. There's guidelines on what item types actually should have what lengths of time associated with them. We err on the side of giving the candidate a little bit more time, so that they have the extra little bump there. But the I guess the underlying thing is, to answer your question, yes, the length of the examination can impact performance, and the National Registry is aware of the impact of the length of the exam. And their psychometrics team does an excellent job of making sure that the research is aligned with the decisions that are being made, is aligned with evidence-based research in terms of the times the candidates are in the seats and the amount of breaks that they're getting.
Okay. Okay, this is from Kyle Rice. He asks, we hear almost daily online that students are finishing exams in under 70 questions for BLS, 40 to 60 questions, and under 80 for ALS. I'm sorry, I'm having a hard time understanding this question. He's asking, do you have data regarding the possibility of that?
Yeah, so I hear that too, right? I hear people asking me about that, and I see it online. Hey, I passed the National Registry exam, but I only got 55 test questions. I can tell you confidently that that's not happening. We have to have a minimum number of exposures for our tests in terms of so for EMT, for instance, minimum is 70, with 10 of those being piloted items, 6 of those being scored items, right? We have to make sure that you get at least 60 items scored and 10 items piloted, which is a total of 70 items before that exam ends. It can't end any sooner than that. So that's not happening. Also, the other, as you bring up, like, hey, look, people feel like they're getting shorter length exams. I often hear that registry will give out a max length exam randomly. Sometimes people are just selected to get 120 or 150 test questions. We don't do that either. It doesn't benefit us. It actually would be a security risk. really, because once we determine if the candidate is to the passing standard or not, the exam ends after it meets the minimum number of test questions, and giving out extra test questions after that will just expose them more unnecessarily. So yeah, no, that's a really good question.
Okay, so far, no new questions are coming up.
All right. Well, hey, I really again appreciate everybody coming out and just kind of talking with me about our exam, and I really appreciate all the work that you guys are doing out in the field right now, and in the classrooms, and for the community and EMS. I'm a former educator myself, and the preparation and the work that goes into the classroom time is just, nobody ever sees that. And so I want to thank you for that time, because that's where the important work really happens. I mean, the classroom time is critical, of course, but all of that prep time and all of the research and everything that you do and putting into your lessons and that hard work is incredibly valuable. So thank you for that. And thank you for your dedication to our profession and to our industry. If it wasn't for educators, I would never have been a paramedic. So as a former student and a provider, I appreciate it. If nobody has any other questions, Emily, I'm not sure with that. Oh, let me give us your contact information here, the next slide here. So if you have any questions, our email is support@nremt.org. Our website is www.nremt.org. That's our phone number there. It's 614-888-4484. You can reach out to us, give us a call if you have any questions or if you think of anything.
Yeah, thank you all for taking the time to be here with us today. Rio, do you have any closing remarks?
Yeah, NAEMSE would love to thank the National Registry for being here with us today and for presenting. We are always happy when we get to partner with you.
Thanks, Rio.
Thank you
Have a
so
great
much.
day, everyone.